A new study is shedding light on just how common sleep problems become and the long-term impact they can have on overall health and well-being.
Co-host of Wake Up America Weekend, Kyle Lowder, is live in studio to break down what's behind the restless nights and what experts say you can do to improve your sleep. Good morning, Kyle.
Good morning, Krisha. Yes, so a new study here shows that stress from work is affecting the sleep quality of many middle-aged adults. So published in the Scientific Reports Journal, researchers found that nearly 9 out of 10, or 92% of the participants, met the clinical threshold for a sleep disorder at least once during the year-long study. So researchers asked 45 middle-aged workers to fill out regular well-being and workplace assessments during the course of a year, as well as wearing devices to capture their physical activity and their sleep. Now, overall, the team collected more than 1,900 reports on well-being and workplace and more than 5,200 days of wearable sensor data. Now, results show that 90% of those participants experienced sleep disturbances, even though most average between 6 and 8 hours of sleep per night. But disrupted sleep likely explained why many people said they felt poorly rested in their self-reports. And workplace experiences consistently emerged as one of the most important factors disrupting the sleep. Now, lead researcher of this study and health professor at the University of Edinburgh in the UK, Anathasios Sanas, said in part, quote, "Our analysis clearly demonstrates that many of these sleep and well-being issues are work-related, with overall well-being heavily dependent on a sustained work-life balance." Now, it's also worth noting that researcher Belinda Stephan, who is a fellow at the University of Edinburgh Business School, added that this research highlights the need for organizations and employers to consider the impact of work-related sleep problems on their workforce. Back to you.
90% of them in that study had sleep problems.
90%.
That's a high percentage.
Yeah.
Unbelievable.
And 9 out of 10 experienced what would be documented as a sleep disorder.
Right.
My goodness.
Yeah.
Well, you're looking well rested this morning.
Yeah, you look great, Kyle.
Oh, thank you. I appreciate it.
Right.
You guys as well. Thank you.
Thank you. All right. Dr. Mina Mirholm is a Columbia University psychiatrist, and Dr. Evan Nadler is the former co-director at Children's Obesity Program at the Children's National Hospital and a surgeon and founder of ProCare Consultants. Really appreciate both of you joining us this morning. I'll start with you, Dr. Mirholm. Wow. I mean, 90%, we were just talking about it, but it seems like they did receive a significant amount of sleep, at least 6 to 8 hours. So what does this tell us really about the quality of sleep versus the quantity?
The biggest takeaway I would say, Krisha, from this study was that you're not just monitoring hours of sleep anymore. It's imagine if you're plugging in your phone overnight because it was, drained, but someone keeps unplugging the power source. So when you're going to a doctor, when you're thinking about your own sleep these days, it's not just how many hours you slept, but think about how rested you feel in the morning. And the data that you get from wearable devices, that was a key part of this study, whether it was Oura rings or smartwatches. This can also give you a bit of an indication about the quality of sleep that you had overnight. Because when they found that 70% or 90% of folks were experiencing either persistent sleep issues or issues that can be qualified as a sleep disorder, while not realizing, am I sleeping 8 hours, then it really is more about the quality versus just the quantity of sleep. And that can really impact a whole lot of mental health concerns that you can see on a day-to-day basis. Sleep is the number one intervention that we want to make in the mental health world to have sustainability, longevity, as well as your performance at work as well.
Mm-hmm. Yeah, Dr. Nadler, I mean, is it possible that these things, with a lack of sleep or at least good deep sleep are, having to do with some of our electronic devices, screens? I mean, are we able to turn our brains off fully? Are we working too much? Or even, wearable sleep trackers. If I'm wearing one of those, I'm not going to get as good of a sleep because I'm going to be thinking about the tracker tracking me. So how do you make sense of any of this?
Yeah, well, thanks for having me, and Krisha, thanks. Yeah. And it's complicated, right? Because this study looked at 45 people from the UK, and if you actually look at the details, 26 of those were in finance. And it's hard to generalize results when you have such a small number, and the different, there was, I think, 7 who were called social care, 7 in manufacturing, and the rest were in self-employment. So what does that really mean? But yes, for sure, screens are important. We know that the blue light from your phone and other screens late at night are things to be avoided. It could be people are answering emails late at night, and that's the work-related stress. People could have sleep apnea, which is super common in the age group that was assessed, which definitely disrupts sleep. So I think while the overall message is important, right, we all probably don't pay enough attention to our sleep and our sleep quality. I wouldn't necessarily say that this study is some breakthrough that no one has ever recognized before. We know that sleep's important, and we know that work sucks. So it's common. It's not really a shock to any of us that we'd rather sleep more and work less. But unfortunately, that's not the way of the world.
Yeah. Simple truths. Certainly, people's minds are working faster than ever these days. I still can't remember what I dream about, though. But that's,
I never know. And I hit the pillow immediately, so I'm out like a light.
Yeah.
But Dr. Mina Mirham and Dr. Evan Nadler, really appreciate your joining us.
Our pleasure.
Thank you, Ram.
Thanks, gentlemen.